and lastly Suswa. Now, the Council of Governors now says it was not involved in the controversial health managed equipment services where all 47 county governments signed a memorandum of understanding. This was revealed when the COG chairman, Wycliffe Oparanya, appeared before an ad hoc committee on health this morning.
We have noted that there are few hospitals where the equipments have been delivered and they are not working. Like E10 County Referral Hospital, there are theater machines that are there, but they are not being used. In Masabit, we have digital X-ray machines that are there, but they are not being used. Anesthetic machines in Muhaya Sub-County Hospital, they are there and are not being used. We found out that because of limited consultation between counties and the Minister of Health officials, some of the equipments which were delivered, there was a duplication, especially in Meru. You will find that some of the equipment that were given, already some of them had been bought by the The usage, I can say here that these equipments have been very helpful to the counties. I think in terms of alleviating most of the problems that the counties had, the then local authorities, these equipments have been very useful. The only problem that we have had is that there was very limited consultation.
The equipment generally has been useful. If I look at, say, dialysis in Nanyuki, you can see that that is something that is working. However, the detail that the committee is asking, some of it is actually not available to us, as we have explained. We are not privy to the contractual arrangement between Ministry of Health and various parties involved in this scheme. It's also not really clear the basis of what is charged to counties. The figure was 95 million. It had recently gone to 200 million without clear explanation as to which additional pieces of equipment are we expecting and for where. So there is quite a bit of detail that is not available to us, and therefore we have not been able to avail it to the committee. Council and even individual counties have attempted to question, okay, for instance, this movement from 95 million per year to 200 million, what is it based on? And we haven't really had a forthright answer as to why that change was made. Finally, Madam Chair, the disbursements related to this program are a bit unusual in that the money actually never goes to the county revenue account.
It does not mention anywhere that the counties were in need of what the national government is doing, does it?
No.
It doesn't. It does not in any way mention the amount of money going to be expended by the national government on behalf of the county government, does it?
It doesn't.
It doesn't. And above all, it gives some list of equipment they are about to lease for you without giving details of the identified hospitals or details of what the hospitals will get. Is that correct?
Yes, correct.
Now, let's get to what you as COG should have done. You protect the interests of the counties as an umbrella organization.
Yes.
When this matter became what it is today,
Yes.
questionable undertakings,
Yes.
did the COG ever at any one time commission an investigation to seek information from each and every county?
No.
Who are your members?
No.
On what happened? You didn't.
Yeah.
Was it an omission on your part?
Maybe.
Maybe. Now, we saw one of the contracts that was given to us by the Auditor General. In that contract, it says the contractor will supply, will train, will maintain, and will supply consumables. In fact, there's only one small contradiction where they say the counties will supply fresh water
And electricity.
and electricity. But in another, they say contractor will.
Yeah.
Now, in a law of leasing, do you understand the same as me that when I lease your vehicle, in terms of agreement, you send me your vehicle, your driver, you maintain it, and I pay you your monthly bill?